Okay, so tell me if I'm wrong, but I remember us leaving off talking about negative feedback. Is that correct?
Yeah.
Okay, so negative feedback, just to kind of reiterate, is where we have a condition getting out of balance, and we try to correct it by going in the opposite direction that the change has been occurring. Like what we see here with blood pressure. Sorry, this is the wrong slide. Blood pressure going up. Some stimulus causes that blood pressure to go up. The receptors within your blood vessels, called baroreceptors, detect that, send the input signal to, in this case, the control center, which is our brain, or a part of the brain. The brain interprets that signal, decides what to do with that input, and elicits the output signal. Output signal, by way of nerve impulses, travels to effectors, which is, in this case is going to be the heart and some blood vessels to do various things, ultimately causing blood pressure to decrease. So it went up, we go the opposite direction, we decrease it, we go down. Okay. If our blood pressure returns back to normal, we feedback and the whole feedback loop shuts off. Okay, so that's negative feedback. As I mentioned the other day, negative feedback is much more common than positive feedback. We can describe positive feedback as stimulatory. It accelerates a change or amplifies the change. So instead of like going up and we push it back down, it goes up, we push it up even farther. Okay. Positive feedback system operates similar to a negative feedback system, except for the way that the response affects the control variable. So we still have the receptors, the control center, the effectors. It's just what's happening to the effectors that's different in positive versus negative. And the control center still provides the command to the effector, but this time the effector produces a physiological response, adding to or reinforcing that initial change in the control variable. The action of a positive feedback system continues until it's interrupted by some mechanism. This is not very common in the body. The best example of this is what's shown over here, and that's childbirth. Since my wife just gave birth, I'm very aware of what I wasn't aware of. Anyway, obviously I know stuff about it because I teach this class, but it's all really fresh in my mind because she was going through contractions, breathing, 5 minutes, contraction, breathing. You know how it all is if you watch movies or if you've had a child. So, what begins this process will be contractions of the wall of the uterus that force the baby's head or body down into the cervix. The cervix is the opening to the uterus. So this is where the baby is starting to push downward through the birth canal. Okay, so that's the original stimulus. Baby's trying to push outward. Okay, the uterus is trying to push the baby outward, I should say. Okay, the condition that's being changed is the amount of stretch in the cervix. When you hear a lady saying, or the doctor saying you're dilated to a 3 or to a 5 or to an 8, they're talking about the amount of stretch of the cervix, how open it is. So the stretch of the cervix occurs, which sends, by way of those stretch-sensitive receptors, an impulse to the control center in the brain. So here's our input signal. The brain, a region of the brain, interprets that signal and says, okay, we are trying to give birth. Let's get it going. Let's amplify. That's why the contractions get stronger and stronger and stronger. And this is why. The brain sends out the output signal. This is actually a hormone, not a nerve signal. Hormone oxytocin travels back to the uterus and causes the muscles to contract more. So this is going to amplify the stretch. Okay, because the baby's going to start pushing through the cervix even more. The more stretch we have, the more oxytocin is released. The more oxytocin is released, the stronger the contraction. So it's just increasing, increasing, increasing. But what eventually stops this whole process? When the baby's born, there's going to be no more stretch on the cervix because the cervix is supposed to go back to being, pretty much closed. And that's what shuts off the feedback loop. Okay. So that's how positive feedback works. Make sense? All right. Now, that was feedback. let's talk a little bit about feed forward. I don't really talk about this too much in this class. Really only a time or two that we will. Feed forward is actually not even discussed in this textbook, but I want to introduce it to you guys anyway. In the feedback system, events occur in response to a change in a control variable. Whereas in a feed-forward control system, events occur in anticipation of a change in a control variable. So one's a response, one's anticipation. To understand how feed-forward control works, consider this example. Suppose that the nutrient concentration in your internal environment becomes too low, causes you to feel hungry. So like your blood sugar is low when you wake up in the morning, so you're hungry. Okay. You see, you smell, or even think about food at this time, you're going to start the process of digestion down, or digestion. Okay. This feed-forward mechanism causes your mouth to salivate, trying to get your mouth wet so that it will be able to mix with the food. Once the food hits your mouth, your stomach actually starts to secrete gastric juice. Digestive juices are being released before food's even in the stomach. This anticipatory response, which is part of what we call the C-palate phase of digestion, prepares the digestive system for food. It's about to be eaten, making it easier for the food to be digested and nutrients to enter the internal environment. So that's pretty cool. How that all works is pretty amazing. All right, homeostatic balance was really kind of the theme of this lecture. Fortunately, we know, we've talked about this quite a bit already, keeping our body in balance is not super easy. Sometimes we are going to fail to maintain homeostatic balance. So homeostatic imbalance occurs when one or more components of our body loses its ability to maintain homeostasis. Now, as long as our body's control conditions remain within certain narrow limits, body cells will function efficiently and homeostasis will be, at least fairly well maintained. Like if our body temperature when we get a fever goes up to 100 degrees, 101, 102, we're going to be okay. We're still within those narrow limits that we're capable of surviving. If the homeostatic imbalance is moderate, though, a disorder or disease may occur. Now, a lot of people will use the terms disorder and disease interchangeably. They're technically not. The definition of disorder, any abnormality of structure or function, whereas disease is a more specific term for illness characterized by a recognizable set of signs and symptoms. A lot of people like to use the terms signs and symptoms interchangeably. Those are not synonymous terms. A sign is an objective change like fever or swelling, whereas a symptom is subjective like headache. What do I mean when I say objective versus subjective? Anybody know? Absolutely. Okay. Objective, think of it as measurable. You can measure fever by sticking a thermometer in their mouth. You can measure swelling by, wrapping a tape measure around somebody's ankle, compared to the other ankle. Heart rate, blood pressure, those are all things that you can measure. Can you measure a headache? Not very easily, can you? You can ask them, how's it feel on a scale of 1 to 10? Okay, but what's one person's 10 compared to another person's 8? It's not comparable across the board, is it? Okay, some people get a hangnail and I think their life's going to end. Some people walk into an ER with a nail sticking out of their leg. Okay, and they have a conversation as it gets yanked out of the leg and they don't even really notice it. So you can't compare subjective. But symptoms are important, and I'll talk about that here more on the next page. If a severe imbalance is bad enough or occurs, it may result in death. Obviously, many different things can cause a severe imbalance. Getting poisoned, losing your head, having a heart attack, so on and so forth. All right, the book talks a little bit about diagnosis, which is the science and skill of distinguishing one disorder or disease from another. Those signs and symptoms that we just talked about are important, along with their medical history, physical exam, and lab tests to help provide the basis for making a diagnosis. If any of you guys like watching medical shows, the best medical show, in my opinion, for the actual real hard-hitting health stuff human body physiology stuff is House. House is less drama, at least in the first few seasons, and more about the science. And Dr. House, if you're not familiar with the show, is a diagnostic doctor. There's always, in every episode, a patient nobody else can figure out what's wrong with them, so they give him the case. He takes the information, symptoms, signs, they do lab tests, they take medical histories, that kind of stuff, and he figures out what's wrong with him. He's performing a diagnosis. What's that? Chicago Med? Never heard that one. I have to check that one out. Cool. All right. What is a medical history? It's a collection of information about the events that might be related to the patient's illness. It includes the chief complaint, which is the primary reason for seeking medical attention, history of present illness, past medical problems, family medical problems, social history, and a review of symptoms. Okay, a lot of times nurses are responsible for doing some of that stuff. Some of you guys said you want to be nurse, so this is right in your wheelhouse. Physical exam is an orderly evaluation of the body and its functions. Process involves non-invasive techniques of inspection. So we're just kind of looking at different things in the body, like when the doctor looks in your ears and your nose and your throat. Anybody know what palpation is? Palpation. Nope, that's palpitations. Palpation means to touch, like when the doctor rubs on your neck. He's feeling for like a swollen lymph node. What about auscultation? You can detect a palpitation with auscultation. It's where you listen using a stethoscope. What about percussion? Somebody playing band? I don't know. What was percussion in band? The drums, right? Okay. Well, you can tap on the body, and that's what percussion is. And it tells different things. Vital signs, those are things like heart rate, blood pressure, your pulse ox, that kind of stuff. So on and so forth, along with lab tests. All part of the physical exam. Last thing I just want to introduce here, we've talked about a couple of these already, are the four major key themes that we will look at throughout this class. Homeostasis, as we've learned, is that maintenance of a relatively stable condition in the body's internal environment. Because homeostasis is vital for the normal functioning of the body, it is the most important theme of physiology. So I've introduced that to you guys right off the bat in this lecture, and it was the title of this entire lecture. Integration is where several components work together to accomplish a particular function. Essentially, all the components of the body, molecules, cells, tissues, organs, and organ systems work together at various levels to keep the body alive. We talked about integration back on that slide where I showed you the various systems, and they had that figure with the lines and arrows pointing in all different directions. Mechanism of action, we're going to learn a lot about how, in which order things occur in the body. Okay, because mechanism of action is the way that the body function is explained. Prominent theme in this class. And then communication, cells of the body must communicate with one another in order for the body to function correctly.